Rise in COVID cases has state officials taking swift action. We're speaking with Chief Nim Kidd of the Texas Division of Emergency Management about testing and the next steps. All right, Chief Kidd, thank you so much for your time.
Thank you. Thanks for having me with you.
So obviously we've been seeing this increase in the number of cases we're experiencing. Was this expected when the state initially started its reopening process?
So, Chris, I think the health and safety of Texans has always been our #1 priority. I think we had many sentinel events that people really didn't necessarily follow the rules for, such as some of the Mother's Day and Memorial Day and graduation parties and ceremonies. And so right now, this pause that we're taking is the right thing to do, and really we need your help in making sure that people are following the health and safety procedures that we put out there. You know, wear the mask. Don't go out in public if you don't have to. Be sure you're washing your hands. We're seeing this increase across the state, but really we can flatten this back out again. If you look statewide, we still have over 12,400 hospital beds are available. And we hear stories that not all beds are staffed, and we know that's true. Nobody staffs a bed that doesn't have a patient in it. But our process will be to staff those beds if we need to get to that point.
All right, along with the increase in the number of cases, we've also seen an increase in the amount of PPE, I should say, by the millions. Was that in preparation for this rise in cases?
So it was in preparation to make sure that we had enough PPE no matter what the future brought us. So far, the state, through the governor's supply chain task force, has ordered, received, paid for, and distributed over 75 million masks that are out there. I still have another 47 million on top of that that are in our inventory today that we have scattered over 9 different warehouses. That doesn't count the 47 million plus that our federal partners have put in the regular healthcare supply chain management, and it doesn't count the additional masks that I still have on order that I expect to receive within the next 45 to 60 days.
So Governor Abbott today obviously announcing some limits placed on some businesses. What can we expect going forward in terms of the amount of testing we're going to see in the state?
Yeah, I think the testing will continue to go, and we have over 890 COVID-19 test sites in the state today. If you'll help me direct your viewers to texas.gov/COVID-19 and then the I Want To site, I want to find a COVID-19 test. And if you're using a mobile app phone, your smartphone, you'll be able to pinpoint your location and see all of the locations within a 5, 10, and 15-mile radius around you of where those sites are. If you click on one of those sites, it'll give you all of the instructions for how to get a test at that site. And really, we're encouraging people to go get tests. We know for a fact that our younger generation, it might be harder for them to contract COVID-19. But when they do, only 1 in 5 of that age group from 10 to 19 actually shows signs and symptoms. That's why it's incredibly important that we continue to cover our faces with a mask when we're outside, that we try to avoid large crowds, and that we continue to wash our hands and do extra cleaning in all those places in the public where we have high-touch areas.
And there was talk of cutting federal funding for some Texas-based testing sites. Well, can you straighten that out for us, what the actual story is?
Absolutely. So today the Vice President announced at his task force press conference that they are continuing funding for the same number of specimens on the federal testing sites in Texas. That will continue for at least another 2 weeks. What we did happen was in El Paso, we worked with our local partners there, and they are transitioning to state-supported and local sites. In the Dallas area, we combined 2 of those locations into 1, but doubled the amount of tests that'll be there, and the city and county of Dallas picked up an additional site to add. In the Houston and Harris County, we kept all of those sites exactly the same and added a few more tests per day. And as you know, we have about a half a dozen or so mobile teams down in the valley supporting our friends down there.
And before we started, this will be the final question, but we did briefly talk about how this is also hurricane season. So how does that compound the struggles of dealing with this pandemic?
So, Chris, we need to keep our eyes focused on COVID-19 right now and make sure we're following all of the instructions that we're asked to. But we can't turn our back on the Gulf. We know that we're in the middle of hurricane season, and we're working very close with our local partners along the coast, as well as those traditional sheltering jurisdictions that are inland, to make sure that we have adequate space, adequate cleaning supplies, and adequate PPE if we are forced into a situation where we have to ask people along the coast to evacuate.
All right, Chief Nim Kidd with the Texas Division of Emergency Management. Sir, thank you again for your time.